If you are concerned about your risk for cognitive impairment or cognitive decline, there are a couple of lab markers that you should be paying attention to and making sure your doctor is running. One of them is homocysteine. High homocysteine levels are linked to cognitive decline. Homocysteine is very inflammatory, and therefore all of that inflammatory cascade, which leads to neurodegenerative disease and neurodegenerative decline, can be impacted by high homocysteine. This is something you should get checked. The other one is C-reactive protein, high sensitivity C-reactive protein. This is a systemic inflammatory marker. A lot of cardiologists run this marker because it's sort of measuring your inflammation in your blood or in your blood vessels. But it is a good systemic inflammatory marker. So we don't want high sensitivity C-reactive protein to be high at all. We want that to be a low number. We want low levels of systemic inflammation. But in the research, anything over 3 on your HSCRP was linked to cognitive impairment, cognitive decline. What does that mean? It means you've got to work hard at reducing systemic inflammation in your body. And for most people in America, that's going to mean looking at your toxic load, looking at subclinical infection levels, looking at dietary choices. That's probably the biggest one is handling dietary issues. We have such an inflammatory diet in this country, and that's going to be the biggest factor that somebody can do. Is what you put in your mouth is going to be a big driving factor in inflammation. There are others, but those are two big ones that are relatively common lab tests that most doctors are not going to object to you asking, hey, can we run my homocysteine and C-reactive protein? I know lots of people complain because they go to doctors and the doctors won't run tests. We actually get people from all over the place. They actually come here because we will run tests. We will do lab work. They know they need data. Lots of people don't feel like they need the provider anymore because they could take the data and plug it into AI and get information, but they don't have a way of getting the information without the lab tests. So we do a lot of specialty lab work. We're not opposed to running blood work to look at things and help people understand what's going on in their health. But those are two tests, homocysteine and C-reactive protein. Anyway, hope you found this helpful. I'm Dr. Dave Morris at Magnolia Medical Center here in Murfreesboro, Tennessee. Be well. And if you could do me a favor, hit the like buttons, hit the share button, and hit the follow button. Bye now.